Thanks, John. I'm just going to quickly introduce Valerie, who's hopefully going to be joining us and has done all the work on this project. But there couldn't have been a better segue into this talk because it is about patient information, leaflets, and you heard a little bit from Valerie last year, so she's going to update you on her findings, which she's been working very, very hard to write up her master's dissertation. She's dedicated it to this project with all of the input that you gave her last year. And I think the tech is working, so I'm going to fade into the background and let Valerie present.
All right, sounds good. Thanks so much for the introduction, Kelly. I'll just try to share my screens. Hopefully my slides are showing up.
Yeah. Yes. Yes.
Well, showing up in here. Okay, perfect. Thank you. So some of you might remember me from last year, since I also had the opportunity at last year's Syndrome UK conference to chat a bit about this project that Kelly and I and the rest of the kind of leaflet steering group has been working on in terms of these nationally standardized Lynch syndrome patient information leaflets, and in particular about designing these resources around patient voices. So just to kind of define our terms, when we talk about these patient information leaflets, we're just talking about these short, patient-oriented resources that are often given by UK clinicians at various points throughout the genetic testing pathway, with the goal of providing a sort of overview or summary of key validated information that ideally is helpful, relevant, and easy to understand. So for instance, if you had, a bowel cancer diagnosis and then received diagnostic genetic testing for Lynch syndrome, you might have received a diagnostic genetic testing leaflet. That's what's supposed to happen in practice, but the reality is a bit different. So regional clinical genetic services, which there are a couple scattered across England at least, will typically make their own local leaflets. And this often results in duplication of effort where, as you guys might have experienced in terms of our wait times, each genetic center uses very limited clinical time resources to design these patient leaflets, and this has a number of negative consequences. Firstly, some services might not produce leaflets at all because of a lack of resources, and secondly, there might be a lack of standardization. So there's often variation in the information that gets shared with patients. There might be inconsistent formats, so some leaflets will have visual aids, some will lack them. Some leaflets might miss out on important signposting to resources like Lynch Syndrome UK. And oftentimes, due to a lack of resources, very few of these regional clinical genetic services leaflets tend to have significant patient or public involvement in the leaflet development. And in particular, when we think about Lynch syndrome, as you guys know very well, Lynch syndrome is one of the most common inherited cancer predisposition syndromes. And I say new guidelines, that's a few years ago now, but either way, the fact is more people are having Lynch syndrome genetic testing in the UK than ever, because now everyone diagnosed with bowel or womb cancer should get some degree of Lynch syndrome screening. But despite all this, as you guys have been experiencing based on the conversation I've been listening in on, most people with Lynch syndrome still feel as though their clinicians are uninformed about Lynch syndrome and they don't really receive helpful clinical info from them. And in fact, based on a recent survey, most pick Lynch syndrome UK as their most useful source of information rather than their clinical genetics or their oncology aids. So when discussing this gap in support with Tracy, she highlighted that there's a desire amongst the community for validated and correct information about Lynch syndrome to be made readily available. So in terms of how this might be achieved, a few years ago, back in 2023, there was a meeting between various kind of patient representatives, as well as UKCGG, CRUK, and Kajin Kanbar, as well as the Association of Genetic Nurses and Counsellors, with the aim of identifying kind of these best practice criteria for developing patient information resources and leaflets to make them as helpful as possible for people who have inherited predisposition to cancer. And they made kind of 26 criteria, so basically 26 recommendations for what makes a leaflet as helpful as possible. And the kind of key they landed on was something called co-design, which is basically just clinicians working together with the patient community to kind of actively involve them in developing these resources, which is sort of just the only logical way to do it, because of course people who live with the condition are best placed to comment on, what's important to know and what's useful for them. So previous research on co-design with the Lynch syndrome community specifically has already shown that it helps ensure that resources are as accessible, relevant, and useful to the target demographic as possible. So with that said, there was a sort of national Lynch syndrome leaflet group that was assembled, many of whom are here today, with the aim of developing these kind of nationally standardized or best practice patient information leaflets about Lynch syndrome using co-design with patients. So as a kind of first step towards this movement, we developed the draft National Lynch Syndrome Diagnostic Genetic Testing Leaflet. It's the first of its kind, but hopefully not the only one. Ideally, we're going to develop a series of these sort of nationally standardized best practice leaflets for Lynch syndrome. And it's been audited towards 21 of these best practice criteria from the 2024 consensus guidelines. Why 21 and not 26? There were just 21 that were deemed relevant for a diagnostic testing leaflet. Some of those criteria were specific for like predictive testing, for instance. So when we audited this leaflet, we found that it met all 21 of these best practice criteria. So for instance, dividing the information into these subheadings, using visual aids, signposting towards resources and charities, support groups. But it was only provisionally compliant with arguably the most important best practice criteria, which is co-design. So how do we address this one? So this was done by collaborating with Lynch Syndrome UK members. Possibly some of you have also completed this feedback survey, so thank you so much. But essentially, we designed a survey that aimed to gather feedback and suggestions for this kind of prototype draft that we made and finalize the kind of national leaflet for Lynch syndrome based on this feedback, and also identify key topics of interest for future Lynch syndrome leaflets developed through the same process based on what people express interest in learning a bit more about. So in summary, the feedback showed that by producing this guideline-compliant draft diagnostic testing leaflet, we had a good start towards national standardization. Overall, the feedback was really positive. So we had a total of 40 responses where the demographic section, along with at least one feedback section, had been completed. I didn't require participants to fill out all the feedback. You guys have more important things to be doing. And of all the kind of 40 participants, everyone reported a lived experience of Lynch syndrome, and all but one had already gone through Lynch syndrome genetic testing. And there's overwhelmingly positive feedback in terms of the general helpfulness and suitability for standardization of the leaflet. So in particular, 100% of participants either strongly or somewhat agreed that the leaflet was useful for those considering Lynch syndrome diagnostic testing, and also should be provided by clinicians as part of routine Lynch syndrome diagnostic testing patient pathways. There's also generally positive but more ambiguous feedback on metrics like being easy to read and having an appropriate level of detail. So what do I mean by that? Here's a kind of column chart summarizing the feedback. So the way that we gathered the sort of Likert scale feedback is that there were 8 statements assessing things that we want the leaflet to achieve, like being readable, being useful, being informative, being inclusive, so on and so forth. And as you can see at the bottom here, we've got these kind of different colors corresponding to whether people strongly agreed with these statements, somewhat agreed, neither agreed nor disagreed, or somewhat disagreed. There was the option to strongly disagree, but no one selected that option, which is why it's not represented in the column. And here in this y-axis is just percentage. So basically each column is just a proportion of how strongly people agree with these statements. So for instance, if you look at this first one, it's the leaflet is useful for those considering diagnostic genetic testing for Lynch syndrome. And this palest color is strongest degree, and you can see that about 70% of people strongly agree with the statement, and then the remaining approximately 30% somewhat agreed. Now, overall, there was generally positive feedback. You can see that there are a couple of statements where the strongly agree is comparatively low. So specifically, a relatively low 60% of people strongly agreed that the draft leaflet was easy to read and understand. And this is a bit worrying for us since Lynch syndrome UK members, who, unlike people who are going through Lynch syndrome diagnostic testing for the first time, are mostly already confirmed Lynch syndrome carriers, are more likely to already have a good understanding of Lynch, since you guys are actively participating in conferences like these, reading mailing lists and so on. So what this tells us is that there's some more work to do in terms of readability, and sort of before finalizing this draft leaflet, we should review it again to try to make it as easy to read as possible. Similarly, only about 60% of participants strongly agreed that the level of detail in the leaflet was appropriate. This is a bit trickier to improve since in the free text responses, which I'll get into in a bit, people specified a range of opinions. So some people felt as though the leaflet needed to be more concise, and some people felt as though it needed to be more detailed. So I think this, rather than having a specific recommendation for changes to be made, is sort of a reflection of people's individual preferences in terms of how detailed leaflets should be, really. We also found that about 2/3 of participants had previously received any type of leaflet pertaining to Lynch syndrome as part of their care pathway. And of these people, most either received their leaflet from Clinical Genetics or from Lip Syndrome UK. So there's actually no one who reported receiving a leaflet exclusively from their oncology team. And this shows that lots of people, so around a third of people at least surveyed, have not been provided with Lip Syndrome patient information resources at the time of testing, with the kind of potential gap coming from people who had their diagnostic genetic testing for Lip Syndrome done in mainstream with oncology. So this is again something that standardization of leaflets could help with. So we found that most participants at least had previously received some form of Lip Syndrome leaflet, and these people were then asked to compare this leaflet against the draft leaflet we developed. So when we did so, we found that 75% of people preferred the guideline-compliant draft National Lip Syndrome Diagnostic Testing leaflet over any Lip Syndrome leaflet they'd previously been given elsewhere. So we applied that same feedback scale to these kind of prior Lip Syndrome leaflets, and I performed a Wilcoxon-Steinberg test. It's just statistics, but this was used to kind of compare these sets of feedback to see if there's any statistically significant differences. So we found that the feedback from the draft leaflet was better than for the prior leaflets, to the point of being statistically significant for the following kind of statements. So in terms of usefulness for those considering Lip Syndrome diagnostic testing, in terms of relevance, inclusivity, having helpful visual aids, and in terms of suitability, standardization. However, we didn't find any significant differences in feedback or readability, informativeness, or appropriateness of level of detail. So it's a bit difficult to tell whether that's because the previous leaflets, which did also generally receive quite positive feedback, were already sufficiently readable, for instance, if they were developed by Lip Syndrome UK, or if this means that there's additional room for improvement in the draft leaflet we developed. We also asked people to provide free text responses to the question of whether there's any extra topics or additional info they'd like to see included in the draft leaflet. So this is just an opportunity for open-ended feedback. And fewer than half of participants provided a response. And again, it's a bit difficult to be sure whether this is because most people felt satisfied that the draft leaflet was suitably informative, or due to understandable survey fatigue amongst the Lip Syndrome UK membership. And of course, there's always generally lower response rates for these open-ended questions versus multiple choice questions. But we did still identify some recurring concepts. Notably, before finalization, we felt that the draft leaflet should be revised to mention rare Lip Syndrome-associated tumor types like sebaceous tumors, since these are now part of the diagnostic testing criteria on the national testing, the National Genomic Database, and also provide a better explanation for that specialized somatic germline Lip Syndrome diagnostic testing process. We also asked people about future Lip Syndrome leaflet topics that they'd be interested in learning a bit more about. Overwhelmingly, as you can see from the word cloud, the top response was aspirin intake, and several participants made specific reference to having a layman's summary of the CAT3 study findings once they're officially published. But other popular topics included Lynch vaccines, gene-specific information / predictive genetic testing, general lifestyle guidance, colonoscopy prep, and cancer-specific information. So in terms of next steps, we were planning on doing something called the Delphi process, which basically just involves consulting a broader panel of clinicians to finalize the draft Lip Syndrome diagnostic testing leaflet based on the feedback we collected. Once this has been completed, the finalized leaflet would then be uploaded to the UKCGG website. And this is with the aim of providing a nationally standardized resource that clinicians providing Lip Syndrome diagnostic testing, whether in clinical genetics or oncology across the UK, can do for their patients. And additionally, this is sort of acting as a pathway proof of concept. So we've shown, based on this feedback, that the guideline-compliant draft leaflet has, overall quite highly positive feedback. So that says something about the benefit of auditing leaflets towards these consensus guidelines. And it also demonstrated an effective approach to co-design, so an effective means of quite efficiently gathering people's feedback opinions. So upon completion of the first two steps, the future directions would also include co-design development of other Lip Syndrome leaflets, possibly with the kind of topics we listed on the previous slide, like aspirin and Lynch vaccine as a launching point. So thank you for listening, and I'd be happy to take any questions.
Wonderful. Questions? They're fading, by the way. They've had a long, hard day. I think you're kind of, you're preaching to the choir here. This is an audience that are already massively on side, but I think everyone appreciates this comes back to the earlier point. We need this kind of material and resource to reach that wider audience, the people who haven't engaged. So it's fantastic work. Yeah.
Hi, interested in how we kind of get the data and perhaps get a larger audience for that data. We were just talking about the idea of using search data, so Google data, to inform the kind of questions that people are asking. You know, if they're going to drop into their, into their search provider, and they're going to ask those questions, and you'll be able to see which are the kind of big hitting questions and what comes up again and again, and then perhaps what comes up at perhaps lower levels, and some of the things where around, say, lynch facts or different testing or the different research projects that people are perhaps looking at as to how you could use that to kind of add further robustness, because you mentioned there obviously the kind of the low numbers sometimes that you're looking at, but that might help. But it's really great to see the push towards getting something standardised, because I think probably people find it really challenging to read different data or different information or different advice, depending on whose leaflet or whose information is there. So.
Yeah, thank you so much. And you raised a really good point also about using sort of search data as a framework for identifying topics of interest or questions of concern, because besides the kind of small sample base, there's also the fact that Lynch Syndrome UK membership is a relatively biased cohort of people with Lynch syndrome. You guys are
I'd say knowledgeable, very knowledgeable.
Too knowledgeable, yeah. I reckon, so something like nearly half of the participants who provided an answer to what topic they'd like to see covered specifically mentioned Sir John Byrne's cat-free study, which I don't think the kind of average person first learning about Lynch syndrome would know to necessarily ask about. So yeah, I think you're completely right that having a sort of broader outlook in terms of investigating future topics is the way to go.
Yeah, so just so that you're aware, we've got Google Search Console. We've recently applied within the charity for Google Ad grants. So we know the search volumes hitting the site of every single term that people are interested in. So it's not a biased cohort, it's UK-wide. We know that Cat3 is the third most search term that people land on the Lynch UK website, which is pretty incredible. Lynch facts is number 5. So we've got this search.
What's number 2 and number 1?
Lynch syndrome and Lynch syndrome UK.
Okay, fine.
So, but this is fine. The search data is a proxy for human behaviour. So if you can understand the Google search data, which we do and I do as a job, it's much more powerful than I think when you're dealing with a 24-person cohort, it's very difficult to draw a distinction of like in the wider market what people actually
do. Really powerful. Yeah, I mean that sort of search data is really very powerful.
Yeah, I think it's great for Lynch patients.
Use the
Not me. No.
Use the microphone.
I think this is great what you're doing for Lynch patients, but I'd like to see getting people before they've got Lynch, because I didn't know I'd got Lynch. I mean, can't we have some leaflets or something that say something like, have you a family history of bowel cancer or uterine cancer? If so, read this, Lynch syndrome. And, just short, effective, brightly coloured, and get people to give those out to community.
But I think in reality, you heard earlier about saving trees. We live in a world where they need to hit Instagram and TikTok, and most people are using their phone. They don't read books.
Yeah.
So I think we've got to get.
But you just something short.
Just in answer to that, with no trees being harmed in the process of Google Ads, we already bid on a huge amount of terms, free of charge. We've got $10,000 a month of Google advertising, hereditary cancer, family history of bowel cancer, all of that. Our ads show.
It's all a cost thing then.
And then all of us, it's totally free. And that's the best thing about this. And we're hitting thousands of people every single month. So it's not kind of dropping a few leaflets.
Do you want to
I think it needs to be something that stands out, because this is what we want.
Okay.
People want. We've got family history. They haven't got
The afternoon is wearing on, and I want to give a talk. Kelly,
Thanks. Thanks very much, Valerie. That was a brilliant presentation and a lot of hard work. And thanks to all of you, because we learn more each time we hear from your questions. Actually, you make us think of things that we didn't. So thank you very much for being so engaged.